Hi there, my name is Dr. Kelly Clarke, and I want to talk about psychoeducational assessments today. So what is a psychoeducational assessment? Psychoeducational assessment is a process where we use standardized measures to measure intelligence, academic skills, emotional, behavioral, social components to what is influencing a student's learning. When are psychoeducational assessments introduced? Typically, assessments start in kindergarten. As soon as kids get in kindergarten, a teacher, after a period of time, is going to utilize, at least in the Edmonton area, something called the Early Years Evaluation Teacher Assessment Tool. And so they will take a look at 5 areas of functioning: awareness of self and development, awareness of self and environment. They'll look at social skills and approaches to learning, cognitive skills. They'll look at language and communication, as well as physical development. So teachers are experts on kids' behaviors. They're very good at starting to observe somebody's development, particularly academically, but they also look at emotional and behavioral features as well. So the psychologist is not involved at that point. A psychoeducational assessment comes further on, but the first introduction to an assessment is early on in kindergarten. So if a student starts to have some difficulties, typically with these ITAs, early year evaluation form, a teacher will speak to the parents, bring them in, talk to them about areas that the student might be having some difficulty. If they're extreme, so typically there might be some difficulties and they'll target interventions to improve these areas, but if they're extreme, sometimes they'll introduce other people like speech or language pathologists, occupational therapists, sometimes behavioral consultants will come in if a student has some severe emotional or behavioral difficulties. And so that's when the student is started to be assisted with some of their challenges in school. A psychologist is introduced when, after about a year or so in kindergarten, if these challenges are not remedied by targeted interventions, then sometimes the school will call on a psychologist to come in and do a psychoeducational assessment. Again, we're taking a look at things like academic skills and intelligence. That's a very basic psychoeducational assessment. Sometimes behavioral evaluation is part of that as well. And so if it's severe, if a student is having, say, some severe behavioral challenges, could be drawn into the assessment process as early as kindergarten. Again, that's pretty extreme. Usually if there's some academic or delays around cognition, that's not introduced unless it's severe, either kindergarten or grade 1, but more typically end of grade 2, grade 3. The reason for that is that a student may be having some delays because of lack of exposure in schooling. Sometimes students are missing a lot of school in kindergarten or grade 1, or you might have a pandemic which has restricted the exposure to education. So we don't know if those delays are related to things like attendance of school or if there's other factors going on. So really, it isn't until about grade 2, late grade 2, grade 3, that when it's clear that the teacher has had some targeted interventions to try to remedy some of those difficulties, that a psychologist is brought in and we take a look at some of those challenges. So at that point, grade 2, late grade 2, grade 3, it's clear that after the teacher has put in place a bunch of supports for the student, that something's going on. Something isn't progressing well, and someone like myself will come in and do a psychoeducational assessment. So one of the things that's commonly asked is, well, why do we need to do an intelligence assessment? Why do we need to do the academic or the behavioral piece? One of the reasons why we do cognitive assessment or an IQ assessment, and IQ basically looks at a person's ability to think and reason or manage the conceptual demands of an educational program. So we want to do IQ testing to rule out that intelligence is a factor contributing to their academic delays. So in other words, if reading, writing, and math are not related to intelligence, in other words, they're smart kids or they're average to above average IQ, then we've ruled out that that's a possible explanation why they're struggling in school. So once the intelligence results come in, we're able to take a look at strengths, areas of limitation, other things IQ tests measure, short-term memory, mental working speed. So there's a lot of information, including learning style. A student might be a better hands-on learner versus a language-based learner, more of an auditory listening learner. So we get a lot of information through the assessment, through the IQ assessment, doing that. Once the IQ assessment is done, we take a look at academic skills. So typically reading, writing, and math skills are taken a look at then. So if through that evaluation, we learn that somebody's really struggling in math, but we've also learned that their intelligence is fine, then we might take a look at, is there a learning disability in mathematics? So a psychoeducational assessment is utilized to determine what's going on, why are there some difficulties, is it related to intelligence, or is it more related to learning? So say, for example, in the case where math is a difficulty, we would take a look at things like their ability to use number reasoning, language-based mathematical reasoning, where if you give a question like, there's 9 geese flying north, 5 more, join them, how many are all together? And so the mathematics skills are taken a look at to see if there's some impairments or delays in math. Typically, we look at reading and writing as well. So the academic portion looks at things like a person's ability to blend sounds together, articulate and sound words and blend endings or beginnings or middles together. And so those skills are also assessed doing an academic assessment. So you may have noticed in consultation with your teacher, your child's teacher, that your child is having difficulties with ability to sound out letters, say for example in kindergarten. And so they can't come up with the ah sound is in apple, A is for apple, and the letter sound association. Or they may have difficulties blending the sounds together. Or they may have difficulty with rhyming words. They cannot come up with rhymes for words. Typically, these are skills that are learned in kindergarten, but say by grade 1, grade 2, they're still having these delays, then we wonder if there is an academic learning disability. So the reason why we do the academic evaluation is to take a look at what is the learning challenges, where are the learning problems, and again, we start to wonder if there's a learning disability that despite exposure to curriculum, so the pandemic was over or whatever delay or lack of exposure they might have had, they're attending school regularly, and despite targeted interventions, to build their ability to learn through phonetic awareness, letter sound associate, all of those things that's being taught, despite those targeted interventions, they're still struggling. So by grade 2 or 3, we take a look at those skills to determine if there's a language or a learning disability. And that's why IQ testing is done, as well as academic, to determine if there is a learning disability and where that might be. The last area that's taken a look at with psychoeducational assessments, at least in early school, are emotional behavioral evaluations. So this is in the case where a student might be having some severe behaviors within the home and school environment. So they may be really struggling with defiance, not following through on instructions, refusal to comply, might be throwing objects, these kind of things, really having a difficult time with managing behavior and their emotions, both at home and in the classroom. So typically a psychoeducational assessment brings in, at least a behavioral, brings in the parents and the teachers as well to bring that information together to give a greater picture of what's going on for the child. So in those cases, you may be looking at severe overt behavior like aggression, conduct problems, but there's also things where we take a look at things like ADHD. So in those cases, kids are having severe difficulties with paying attention, concentration, they're forgetful, they're constantly losing things, they're distracted during instruction, they might be very impulsive, interrupt people while they're speaking, cut them off while they're speaking, blurt out answers while they're listening to instruction, or they might be very hyperactive. They can't sit still, they're getting up and moving around without permission, they're fiddling at their desk, fiddling at the supper table. So when we look at a behavioral evaluation, considering things like overt aggressive behavior, possible ADHD, things like this, as well as emotional factors like anxiety, depressive features, self-doubts, self-esteem, all of those can be also taken a look at during an emotional and behavioral evaluation. So a psychoed evaluation, psychoeducational evaluation, looks at those 3 components, at the very least, cognition or intellectual ability, academic skills, and behavioral. Once those that information is gathered together. It's put together in a psychological report, and the information is then distributed to both the school and the parents, usually in the form of a conference. So we would all meet together, either in person or through virtual meeting, and the results of the assessment are gone over with the parents and, say, the teacher or assistant principal. And then after the results are shared, often there may be a diagnosis, like that there's a learning disability or that there's some behavioral challenges, possible ADHD. Once the school has all that information and the parents, then there usually is something called an individual program plan or an IPP, in which the school targets these areas, supports the student that has these needs, and implements those things both in the school and with suggestions to the parents to help them as they're progressing through school. So after the results are all gathered, then the school will continue to utilize the IPP to share with the parents the progress that's being made, and if the student is improving, and if not, the new supports are put in place, and that's how it would continue on with a continuous evaluation of those areas. So in short, a psychoeducational assessment usually takes a look at three factors: intelligence, academic skills, as a very basic psychoeducational, and if there are behavioral, emotional factors such as anxiety, depression, hyperactivity, inattention, a behavioral assessment is completed as well. I'm Dr. Kelly Clarke, and you can reach me at drkellyclarke.com.